Cosmic reverberation. Om is the source of creation. Appreciation of the creation requires divine vision. Material marvels of Mother Nature can be appreciated with our physical senses. The sense of perception and transcendental thinking gave birth to the human civilization and our value systems. When the abilities bestowed do not function to their potential, questions arise if the world is livable at all for these disabled. With affirmative actions and solutions, 𝐒𝐀𝐊𝐒𝐿 boldly stands up to give a befitting answer. 𝐒𝐀𝐊𝐒𝐿 in Sanskrit means enabling. Founded on the principles of inclusivity, skill development and research, 𝐒𝐀𝐊𝐒𝐿 appreciates the special abilities of the disabled and aptly calls them Divyangs. These empowered Divyangs contribute constructively to society. Since its inception on 20th June 2008, with an ambitious goal of empowering over 30 million Divyangs, 𝐒𝐀𝐊𝐒𝐿 undertook many outreach activities and projects. It expanded rapidly to every nook and corner of India. As a beacon of hope for Divyangs across the country, 𝐒𝐀𝐊𝐒𝐿 implements measurable, achievable and time-bound programs that support their health, education, employment and social rehabilitation. The 21 disabilities recognized by the Government of India under the RPD Act 2016 were categorized into 7 verticals or Kshamata Vikas Prakoshs by 𝐒𝐀𝐊𝐒𝐿. Taking a pledge to mitigate avoidable blindness from Bharat, 𝐒𝐀𝐊𝐒𝐿 conducts regular free eye camps to identify and treat cataract, squint and corneal blindness. To enlighten the lives of the visually challenged, 𝐒𝐀𝐊𝐒𝐿 volunteers record audiobooks, print braille books, sign up as scribes for writing examinations, empower them with computer education, software skills and provide vocational training for employment. To identify hearing impairment in the newborns, advanced tests are conducted. Life-changing cochlear implant surgeries are facilitated and speech therapy is provided under the Pranav project. The uniqueness of this model is mothers are trained as rehabilitation therapists. Hereditary blood disorders such as thalassemia, sickle cell disease and hemophilia demand lifelong blood transfusions and medical support. Pranada, an initiative of 𝐒𝐀𝐊𝐒𝐿 with an army of blood donors, alleviates the suffering of the affected. Intellectually challenged children are given various therapies and special education under the initiative 𝐒𝐲𝐻𝐻𝐾. Parents are trained as therapists and trainers. These primary carers are now becoming part of advocacy groups. Chaitana, a vertical of 𝐒𝐀𝐊𝐒𝐿, promotes public awareness about mental health issues. Rehabilitation of the affected individuals is undertaken by early identification, treatment and counseling. Locomotor disabled receive technical training, rehabilitation services, corrective surgeries, prosthetic limbs and mobility aids from 𝐒𝐀𝐊𝐒𝐿. The leprosy affected are provided medical and dressing facilities as well as MCR footwear by 𝐒𝐀𝐊𝐒𝐿. Once their medical needs are resolved, the focus shifts to occasional training and organizing self-help groups to make them resourceful. The role of 𝐒𝐀𝐊 has to be admired in encouraging and inducting eligible Divyang bachelors to the ancient traditional moorings of family life by performing sacred marriage rituals and reigniting a sense of fulfillment in their lives. Courageous and aspiring Divyangs are trained in sporting activities such as cricket, chess and basketball. They break the shackles of the societal presumptions as their physical and mental toughness is groomed. 𝐒𝐀𝐊 takes inspiration from those Divyangs who brought international accolades for the country. Sports events such as Enablathon and Divya Kumbh are organized on the occasion of International Disability Day. To raise awareness on the struggles of blindness, a novel 2-kilometer blindfold walk, Sight-thon, was organized. Citizens of all ages participated enthusiastically for the cause of Divyangs. The concept of the blind leading the blindfolded gave people a first-hand experience of the tenacity and vivacity of the visually challenged, which culminated in voluntary eye donation. Kumbh Mela, the largest human congregation ever on earth to seek the blessings of Mother Ganga, was held at Prayagraj. 𝐒𝐀𝐊 matched the occasion with an ambitious plan to identify and treat the visually impaired among the pilgrims. After conducting a spectacular eye camp, Netra Kumbh, uninterruptedly for 52 days and screening over 2 lakh people, 𝐒𝐀𝐊 distributed around 1.5 lakh spectacles on the same day of testing. This phenomenal feat of 𝐒𝐀𝐊 found a place in both the Limca and the Golden Book of World Records. To encourage the exuberance of Divyangs and showcase their special talents, 𝐒𝐀𝐊 coordinated with various NGOs and conducted many cultural and sporting events. Prosthetic limbs, mobility scooters and tricycles are arranged to the needful. The immense efforts of the empowerment of the Divyangs were supported with open arms and partnered by various organizations. 𝐒𝐀𝐊's flagship program 𝐾𝐈 works towards the prevention and treatment of corneal blindness. The Jandewala Mata Mandir Trust, Surya Foundation, Continental Coffee and National Fertilizer Corporation supports the efforts. This program was later adopted by the governments of Telangana and Andhra Pradesh as Kanti Velugu projects and benefited millions in both Telugu states. Ambulances donated by NTT Data and Bharat Petroleum. TLM educational kits for the special needs children provided by the SBI and NTT Data benefit many Divyangs. Pranav at Nilofer Hospital, Hyderabad is funded by Synchrony Financial. World-class hearing tests are performed on all the newborn with subsequent speech therapy, hearing aids and cochlear implant surgeries for those who need them. 𝐒𝐀𝐊 is pleased to report that over 24,000 newborns were benefited in the first 2 years of this project. World Health Organization, a subsidiary of the United Nations, invited 𝐒𝐀𝐊 to share the experiences of Pranav in the World Hearing Forum. Impressed by the progress achieved, WHO put its best foot forward to work in partnership with Pranav. 𝐒𝐀𝐊𝐿 considers this as a proud moment and victory of all the Divyangs of India. When the corona pandemic caused turmoil across the globe, Divyangs needed support and compassion from their fellow citizens. 𝐒𝐀𝐊 worked tirelessly during the lockdown period to provide face masks, sanitizers, and essential grocery items to safeguard them. Continuation of these unwavering efforts of 𝐒𝐀𝐊 requires generous monetary support and human resources. 𝐒𝐀𝐊 bows with humility to the benevolent philanthropists and magnanimous donor institutions who supported the ambition of integrating Divyangs into the society.
सक्षम भारत, समर्थ भारत।